Today we're going to talk about pseudomyogenic hemangioendothelioma. On your right, you have a PET scan that shows PET avid lesions, which turn out to be a pseudomyogenic hemangioendothelioma. A one-liner is it's a rare endothelial cell neoplasm, often in young adult males. Mean age is 30, often presenting as multiple nodules in different tissue planes, characterized by plump, spindled cells and positive staining for FosB, ERG, and cytokeratins. And here we have a intermediate power view of a spindled cell neoplasm, and on higher power you can see these plump spindled cells with abundant eosinophilic cytoplasm. The location, 60% are multifocal, 75% present as cutaneous and subcutaneous nodule, 50% are intramuscular lesions, and 20% as lytic bone lesions. And as we've seen before, they are PET avid, and as you can see here. And here we can see an intramuscular multifocal across different tissue planes. Location-wise, 55% occur in the lower limbs, 20% in the upper limbs, 20% in the trunk, and 5% head and neck. And so in the lower limbs, we can see some pseudomyogenic hemangioendothelioma. Here's in the subcutaneous, here's in the bone. You can see the lesion right here as well on the foot. Grossly, most tumor nodules are 1 to 2.5 centimeters in greatest dimensions. The cut surface is firm, gray, or white, and the margins are ill-defined. Molecularly, there's a translocation of 719, fusion of SERPINE1 to FosB, and alternative fusion is ACTB to FosB. Thus, you can use nuclear staining for FosB for pseudomyogenic hemangioendothelioma. In this instance, you can see the IHC for FosB is positive in the tumor cells, and you can appreciate the multifocality and across different tissue planes. On histology, the architecture will be sheets and fascicles. Cytologically, you'll have plump spindled cells with abundant eosinophilic cytoplasm. It may have an epithelioid morphology. You can see vesicular nuclei with generally small nucleoli. Usually there's mild to atypia and scarce mitotic activity. In the background, you'll have 50% of cases contain prominent stromal neutrophils, so that could be a hint. And the margins are infiltrated. So here is that H&E correlate of the FosB stainings tumor that we of the FosB IHC that we just saw, and you can appreciate the tumor cells here. Or here are more histologic pictures of pseudomyogenic hemangioendothelioma. You can see the growth in nodules. You can appreciate how, the spindled nature of these cells. You can appreciate how the epithelioid tumor cells are rich in eosinophilic cytoplasm. And you can appreciate some of the nucleolus and how there are neutrophils, plasma cells, and eosinophils in the stroma. Here's another example of a subcutaneous pseudomyogenic hemangioendothelioma. Again, the plump spindled nature of this tumor with these nucleoli as well. IHC-wise, your cytokeratins AE1, AE3 will be diffuse positive, as you can see here. ERG and FLY1 can be positive. You can see the ERG stain in D. CD31 can be positive 50% of the times, and in this case it was positive. And you can have focal SMA expression, and you will have nuclear FosB. Again, here is another example of pseudomyogenic hemangioendothelioma, positive for cytokeratins, AE1, AE3, and the tumor cells here are negative for CD34. They are positive for ERG. And the treatment is excision to amputation, chemotherapy, and radiotherapy. Prognosis, 60% have local recurrences, usually within 1 to 2 years. The relationship between margin status and recurrence not yet established, and regional lymph node and distant metastasis is rare, less than 5%. Here are my references, and thank you for watching.